Let's say a woman comes and she's having super crazy menstrual cycles to the point where she has to get the pain medication, on board the first day. She has super clots, it's super heavy. She has all the irritability, just like literally she hates her menses every month because it's a death sentence for her, right? So as a clinical herbalist and having a conversation with somebody like that, I'm going to ask her, what's going on? I need a food diary. Let me look at your food diary. Let's assess this. What kind of medications are you on? What do you do for a job? Are you in a job where you're on your feet for 8 to 10 hours a day running around like most nurses? Or are you sitting at a desk typing all day? Are you a truck driver? Are you a stay-at-home mom? What are all these different components that are causing your menses to be so uncomfortable for you, right? And then on top of that, I'm going to ask you too, okay, so let's look at some of the relationships you have with people. Is there some trauma trapped in your body that you haven't resolved or haven't reckoned with that's causing all of this imbalance within your womb space? So as a clinical herbalist, I'm going to have that conversation. We're going to handle all those areas to see what is the actual root of the imbalance.
Hello and welcome to the Midwifery Wisdom Podcast to all our listeners. I am Shiphrah Israel. I am a student midwife, a doula podcast host, here to have conversations relevant to our birthing world, midwives, and beyond. I have the pleasure of having Zaire Sabb here with us today, a clinical herbalist, amongst many other things. Zaire, I always say that it's easiest to tell your own story. So tell us a little bit about yourself and how you became known as the modern day medicine woman.
Peace and blessings, everyone. Thank you for having me, Shiphrah. This is such an honor to be here with you today. Okay, so a little bit about me. I've always been that one person in the community, in your neighborhood, in corporate America. Every time someone got sick, it's like, oh, don't go to the doctor. Just take some garlic with honey or take some lemon tea or maybe get this plant, do this, and do this. That's always been my thing since I was a little kid. As I got older, I wanted to find a way that I could incorporate that into everyday life. So for a moment, I actually turned away from it and actually went into allopathic medicine, where I became a advanced practicing nurse. My specialty within that particular space was pediatric cardiac transplant. One of the things that I started seeing was an interesting dynamic in demographics of the patients I would take care of. There was one group of patients who always seemed to have structural challenges, so to speak. And then there was another group that would have metabolic challenges. And when I started having deeper conversation with those families, I found out that there was a lot of miseducation and or no education about proper prenatal care. There was a lot of implicit biasness happening, a lot of not being heard from parents and families and stuff. And I'm a Leo, so we can't just you can't just give us anything and just expect us to accept it, right? So I started having more conversations with providers within the hospital space, and it became a little contentious. So I started easing out of the allopathic space and going into midwifery. Actually started out as a doula. My very first client as a doula, my trainer and my client said I had no business being a doula because I just knew too much information and I was doing too much stuff. So after about a year as a doula, I started transitioning and learning midwifery. So I am actually what's considered a traditional midwife. And what a traditional midwife is, we are someone who combines both the spiritual aspects of birth, the birthing space, as well as the technical stuff, right? And we actually will work from day one as an apprentice versus going to grad school, nursing grad school, and then, going into practicum. CPMs have to do a lot of MEEC, where they have to do, to find somebody to check them off on things. So from day one, I started apprenticing versus theory first. So I did my theory and my practicum all at the same time. I was trained by the late great, who was a grand midwife in Georgia. And for anybody who don't know anything about the grand midwives, literally they are the OGs in the birth space. These are women who have literally, if you ask them what jobs they ever had, they'll tell you the only job they've ever had was catching babies. They learn from their mothers or their grandmothers or community mothers, and that's all they've ever done is just catch babies. I was working with her for about 5 years now, in the midwifery space for about 5 years. So, in tandem to that, like I said, as a child, I was always one playing in the dirt, trying to heal everybody with my mud pies. Even within the allopathic space, I was always talking to my clients and their families about different things they could do to help themselves holistically so they don't have to keep ending back up in the hospital, whether it was advising them on nutritional realities, so to speak, or just better health practices in general. So before I even got into midwifery, I was working as a herbalist, a self-taught herbalist. Once I left the allopathic medicine space, I I went to Botona Logos in Clayton, Georgia, where I studied under Miss Patricia Christie Howell. And then I moved even further into my studies by going to Africa and learning under Chief Aresa from Ibadan, Nigeria, International Green Circle, and then working with Chief Bankole Popula with Sable Wellness out of Lagos, Nigeria. And so that whole roundabout, that's how we came to where I am now. I started my own practice, Mystic Momma Herbals. I'm the owner and curator of it. What I wanted to do was get a hold of people before it became a problem. Within a lot of our communities, regardless of skin tone, there is a huge disconnect from what's right, what's wrong, what's normal, what's abnormal, what's common versus abnormal. So I married my midwifery with my herbalism. I am a clinical herbalist midwife, mainly because with the clinical part, I know how to read blood work, I know how to read imaging results, and I help translate that to whoever I'm working with. Okay. And so in that space, I'm actually even going further where I have gotten my functional medicine component, and I'm also a doctoral student of natural medicine. By August next year, I should have my doctorate. And be able to have like some real, like the big letters behind the name. So yeah, so that's kind of like the long short way around how I got to where I am.
A lot of watering and seeds went into this, fruit.
Exactly.
Initially, you were an herbalist, but self-taught, and then now you consider yourself to be a clinical herbalist. Differentiating factor makes you a clinical herbalist.
For me, there's a responsibility attached to it. So right now, let's say in your garden you had echinacea. Okay. In reality, if you know how to use echinacea, you could make the tea, make the tincture, whatever, and you can give some to somebody that came to you and they were having some challenges, maybe some immune challenges. Technically, you would be considered an herbalist. That's not necessarily, that doesn't include you into an accountability. If this person, let's say they have an allergic reaction to it, you didn't do a full assessment, you didn't do nothing. You just had a person call you up and say, "Hey, Shiphrah, I noticed you had echinacea in your garden. Can you make me a tea?" When you become a clinical herbalist, there is a level of responsibility and accountability because you're actually going to look at the whole person and you're going to help with all the interconnectedness. So a good example would be, let's say a woman comes and she's having super crazy menstrual cycles to the point where she has to get the pain medication, on board the first day. She has super clots, it's super heavy. She has all the irritability, just like literally she hates her menses every month because it's just, it's a death sentence for her, right? So as a clinical herbalist, And having a conversation with somebody like that, I'm going to ask her, what's going on? I need a food diary. Let me look at your food diary. Let's assess this. What kind of medications are you on? What do you do for a job? Are you in a job where you're on your feet for 8 to 10 hours a day running around, like most nurses? Or are you sitting at a desk typing all day? Are you a truck driver? Are you a stay-at-home mom? What are all these different components that are causing your menses to be so uncomfortable for you, right? And then on top of that, I'm going to ask you too, okay, so let's look at some of the relationships you have with people. Is there some trauma trapped in your body that you haven't resolved or haven't reckoned with that's causing all of this imbalance within your womb space? So as a clinical herbalist, I'm going to have that conversation and we're going to handle all those areas to see what is the actual root of the imbalance. Whereas another herbalist may not even go that deep. They just may be, oh, okay, we'll have some cramp bark and make
Right.
sure you don't eat no ice before your menses, right? So it's the level of, it's the depth, it's the level of in your business, so to speak. And I think that's what makes a difference. Whereas like a community herbalist, that's going to be more so your people who have blanket formulas to help with situations. So pretty much like if you were to go into a vitamin shop or something like that, you don't really know the people there. They don't know you. All you do is go in and say, hey, I've been, I had a cold the other day. I need some stuff. Okay, well, there's vitamin C over there. A community herbalist will have blanket formulas or cookie cutter formulas
Right.
that help with certain, imbalances, whereas a clinical herbalist is going to sit there and we're going to actually nitpick it and customize it to whatever it is that you have going on based on your constitution, based on how you live your life. So let's say you're a construction worker. I can't give you 5 different formulas to take in one day. It's just not going to happen. I
Mhm.
probably got one time throughout the day to make sure you take something, and it may be a tea versus a tincture or something like that. So that's kind of the depth of how it goes, you
Mhm.
know.
For the listeners who are in all of your story of, learn through herbalists in Georgia,
Mhm.
Nigeria, and Africa, a very grand way of coming to this knowledge. For someone saying, well, I would love to grow from being a garden herbalist, for example,
Mhm.
community herbalist, to being a clinical herbalist, who don't have access to going to Nigeria and to the elders that you may have encountered, how would you advise someone to enter into a more clinical space of herbalism?
Okay, so there's levels to this. Understand, one, I have a very science mind. So for me, I'm never satisfied with just knowing echinacea works for this. Okay, well, why? What is it about that particular plant taken in this particular space makes it do what it do?
The mechanism.
So
Mhm.
exactly, how does it actually work? If you are a science geek like myself, and take the deep dive, there are tons of university degrees and stuff like that you can take. But honestly, just literally taking the step to go through a foundationals class. The foundations class is everything, right? So in a foundation herbalism class, you learn the botany of a plant. You actually learn all those key components, the pharmacological aspects of the plant, all the phytonutrients, all the herbal actions. You learn actually what plants do. I teach a foundational class called Roots to Remedies, and that's what we go over like the first 2 months. That's what we're going over is like, what is it about this particular plant? How do you even find it in real life? Because one of like for me, I refuse to call anybody a herbalist that doesn't know what echinacea looks like in real life.
Mhm.
There are a lot of herbalists out there who only order herbs online and they only get them dried,
Right.
but they have them growing in their yard and have no clue what they look like,
Mhm.
right? Take a foundations class. Definitely learn what's growing around you. One of my mentors throughout my life always told me, he said, you need to be able to go into anybody's neighborhood on the planet, anywhere, and find at least 5 plants that can help you do what you need to get done. literally recognizing what's growing around us, because this stuff is not just in the air, like literally it's in your yard. What I challenge my students to do sometimes, I'll have them not mow their lawn for like a month. Now, mind you, if your HOA is sending you, hate mail, do what you got to do. But yeah, right. No, look, we are not trying to get no citations up in here. But let it grow wild. And then there's a book called Newcomb's Wildflower Guide. Literally take that book and go through your backyard and try to see what's growing in your backyard, right? And then so like down here in the South, we got red clover all over the place. Red clover and white clover all over the place. That's fantastic for the kidneys. Not the banana planting, but the actual plant planting. You know, you'd be surprised how people will like, oh, we're gonna go get the banana. No, that's
right. I'm like, oh, I love a plantain.
Exactly. That's not what we're talking about. But we have plantain that grows here on the ground, which is fantastic for the skin. It's a fantastic tissue repairer. Everybody knows we got dandelion. We have dandelion for days. Perfect for detoxing. It's a diuretic. It's anti-inflammatory. It's nutritive. Every part of it can be used. It can be used for coffee. Like it's all the things. Literally just taking the time and seeing what's in your yard is like the first step. With the way healthcare is going, with the way society is going, with the way access to certain things are going, if we don't advocate for ourselves, if we don't know that I have a plant in my backyard that can do X amount of things, cheap, you know what I'm saying? It's like just laying your life out to whatever modern medicine decides to do with you. When the entire time you had a whole plant in your yard for free. You could be drinking tea, making your tinctures, eating it every day, whatever. My two biggest things would be to start there. Do a foundations class and then learn what is around you. Start with those two things. If you don't want to do the class, that's fine. You can be self-taught. Just get the right information. TikTok University is not always the best. It's a little deeper than that. Believe it or not, if you were going to do online free learning, I would rather you do YouTube over TikTok, because there are legitimate lectures on YouTube that are like 2 or 3 hours long versus TikTok is what, a minute and a half, 2 minutes or whatever.
Even throughout a book for people to be able to read. That's YouTube is definitely a great feature as well, but there's books that'll help you.
Yeah, tons of books.
I understand that you have a book that you have written as well. Can you tell us a little bit?
Yes. So my book is called Herbal Harmony, a comprehensive guide to using herbs to help with reproductive health. And literally what I did is I combined all of my information into one space. One of the things that I work with a lot is educating people in terms of how you got from point A to point B, and why is it now C. Example, fibroids, for example. A lot of people don't understand that fibroids did not start on Monday and you got diagnosed on Tuesday. It's 2025 now. So the fibroids started maybe like in 2020. It started like in 2015. And every single client I talk to, they always say, well, no one ever told me. Well, the thing about allopathic medicine is that it has to reach a certain level in order for them to acknowledge it and do something about it. So a lot of times I'll tell them, go back and look at your exams or whatnot from different x-rays or different providers in the past, because a lot of times the information is sitting right there, but because it wasn't large enough or you weren't complaining about it enough, it just got swiped to the left, so to speak. So within the book, I talk about hormone imbalances. A lot of times people don't understand that this whole life is a dance. The body is such a beautiful thing, but I promise you, with the wrong misstep in this dance, you're dancing by yourself, right? Because it's a real thing. Like people don't understand. Like, so example, one of the things I talk about is unresolved emotions, right? Every single person listening, I promise you, if you go back into your history, your life on this planet, there was a point in time where you took a L, where there was a situation happened, you felt as if you were unvalidated, you were wronged or whatever. And for whatever reason, instead of going scorched earth, he's like, you know what? I'm gonna give you this one. I'm gonna take the L on this one. I'm gonna sit back and just deal with it. Now you said that out your mouth, but your heart was still like, oh no, I'm gonna hold this, I'm gonna hold this because it hurt me really bad, right? But what you do is you put it on the cabinet and decide to deal with it later, but you never get back to it. Now, the energy of whatever that particular thing was, over time, it starts to build and build until it becomes something pathological, which could be in the form of a cyst on the womb space somewhere, could be super extra painful menses, could be super extra clotty menses, stuff like that. But it all came because you did not release the energy of whatever that thing that you put up was, right? So that's the first part. The second part is because now you have this menses situation, you are putting your body into a state of free fall almost every month, right? And because of this free fall, you may inadvertently be causing damage to your body because of the amount of stress that's involved with, like, if you know your menses is going to take you out every month, the trepidation of knowing that time is coming up, it starts to cause anxiety in the body. Over time, constant anxiety causes issues with the thyroid, causes issues in the gut. Okay, now you have IBS. So it went from something out here in the energetic world, and now it's a full blown. Now I got to go to the gastroenterologist and get proton, PPIs or whatever. In the book, I spend a lot of time talking about that. I also talk about the anatomy and physiology. A lot of us don't know what we have down there. We know, like, the big players, we have ovaries and a fallopian tube, the big players. But all the other little pieces and how they work and how they interconnect, don't even know. And what's even crazier is when I was talking with some other practitioners about the book, we all agreed we don't remember talking about this in anatomy and physiology class. We talked about birth in terms of, okay, the woman gets pregnant and then 9 months, and month one, this was happening with the baby, month two, and so forth, but never talked about what was going on with the body. Like, what are the main key players anatomically, even with menopause? No one ever explains, they explain menopause as you just can't give birth no more. It's a little bit deeper than that. Like, it's a little bit more deeper than that, right? Because it's literally the body's inability to make proper or appropriate levels of estrogen. So you have both estrogen and progesterone going down at the same time. And because it goes down at the same time, hot flashes, irritability, insulin resistance, all the things. So I talk about that in the book. I even talk about our men. For so long, our men have been quiet for all the reasons. And it's like, I need y'all to stop being quiet because some of y'all stuff is messing up my stuff, right? Because if a man's pH of his fluids too acidic or too alkaline, and then your stuff is a certain level of alkaline or acidic, and it comes together, now we have a pH imbalance, and we most likely will have some type of bacterial vaginosis. I talk about that in the book, and I also talk about food. We can't do any of this without talking about food,
Right.
Because I love it. I love, the funniest thing is talking with somebody that has a very strong cultural food association and then telling them they can't eat that no more. That's such a fun conversation. I love my Caribbean people. I love y'all. But y'all have some of the worst food combinations out there.
So, with that being said, who is Herbal Harmony really for? Is it for the woman who has problems to solve? Is it for someone who's having issues? Who should be reading this book?
You mean other than everybody?
That's right.
Okay. The book, honestly, is for anybody who thought they were crazy and needed someone to let them know that, no, you're not crazy. That little thing that you feel every month right there, that is common. It is not normal. One of the things that allopathic medicine like to tell us, and when I say us, I'm talking very specifically about women, is that everything we go through is a variation of normal. No, it's not. It is common, but it is absolutely abnormal to bleed for 7 to 12 days. It is absolutely abnormal to have, like, you have beautiful skin. If your menses came on, you got a big old cystic zit right here. It's like, why? Receding hairlines after you give birth, like the postpartum hair loss and stuff. It's common, but it's not normal. It's not normal. For anybody who's ever had that suspicion that something was off, but they couldn't pinpoint what was off, and they try to go to the provider, they got devalued or even just not heard. And that could be both male or female. For my mothers, it's so that we can start having these conversations with our babies.
That's right.
I kid you not. I learned about all this by watching HBO. So, right? We have generations of not having these kind of conversations. We need to have these conversations. You need to know the women in your family, what age were they when they naturally went into menopause, so that you can get yourself ready and start paying attention, because menopause is also one of the things that doesn't start on a Monday. It started 5 years ago on a Monday. If you in your mind already know that, hey, this side of my family typically goes into menopause, let me start making sure I'm having, all the things I need, make sure I'm eating right, make sure I'm having the right amount of rest and downtime and whatnot. So literally anybody who's ever had to question what was going on with their body and needed it explained in a very simple format. That's
Well,
what's weird.
with that, I say thank you for creating a space and a resource for those of us who have questions, those of us who have the responsibility to teach others, those of us who have hormones, which again is everybody.
It is everybody.
Thank you for the wisdom that you have provided for those who hope to be able to spread that wisdom and obtain it for themselves as well.
Thank you so much.
With that being said, once again, you all, we have Ms. Zaire Sabb here. You can find her book, The Herbal Harmony, at Amazon. And our last words that you would like to share with the audience regarding your book?
Yes, so it is on Amazon. You can download it with Kindle, and it's also available on my website, www.mysticmommaherbals.com. And just understand the book is really set up so that you can have a conversation with your provider. I don't want you to think your provider woke up in the morning and decided to just be a douchebag. That's not how any of them live their lives. It may feel like it, but that's not how they actually live their lives. Their challenges with allopathic medicine, from state laws, federal laws, insurance, and all the kind of things, when they're held hostage to all of that stuff, they actually lose the ability to sit and hold space for their clients because they only got 15, 20 minutes at best. So one, don't hold it against them. Two, use the book to educate yourself, because literally you are your best doctor. You know that every day at 2 o'clock in the morning, you wake up. There's a reason why you're waking up at 2 o'clock in the morning every day. And it could be either spiritual or it could be physical, or it could be a combination of both. So the book is set up to be that resource so that you can have the conversations and so that you can put the pieces together for your own sanity, safety, and sovereignty. Okay.
I appreciate that. I kind of laugh to myself, as a person who do realize the power of herbal and natural medicine, but also marrying it with allopathic medicine, utilizing your doctors for the expertise and resources they have, but also with a background in, midwifery. Talk with the client for 30 minutes, an hour or more. And I guess, they say, oh, so what's going on? You give them an introduction, right? You give them the they're like, okay, check, walking out. I'm like, oh, I thought we was just getting started. That being said, coming in information armed and ready to go with a level of understanding really can just set you so far ahead of the game with having that conversation with your provider. So
exactly. So, and then also too, real quick. So, you're a birth worker too. So this actually will help you too. So do you do preconception work? So this right here is right up your alley. So when you're talking with your clients in preconception and you're like, look, I need you to get off the fast food regimen, okay? And these are all the reasons why.
Right.
I need you to not do the fast food regimen. I need you and your mate, your partner, whatever you want to call them, to come together and actually do stuff together. Because that's the other part that happens, especially in the reproduction space. It's always us. They act like the men and don't have nothing wrong with them. No, baby. No. It took two, not
Mm-hmm.
just one. It took two. So if I'm going to do a 21-day detox, sir, you are too. Ma'am, you are too. Okay.
Mm-hmm.
And this is the reason why you do these as a couple. Okay. I do a lot of work with IVF and IUI clients.
Mm-hmm.
Oh, bless their heart. I got to take them so far off the ledge because, they get into that schedule exactly at this time and do this. I'm like, stop. Y'all see, stop. Throw the schedule out. Go have a vacation. Go get drunk and have wild, crazy sex like y'all did when y'all first met. Okay, all because I kid you not, the amount of stress and cortisol that you're releasing, trying to make sure you adhere to the time frames that the specialist told you to do, you won't get pregnant that way. Because who wants to have sex based on a schedule? That takes, no. If you relax and just remember why you enjoyed it to begin with, it goes so much better. Everything tastes so much better, so yeah,
Finding a way to release control to a certain extent is definitely
exactly.
having
Exactly.
a faith. And like I said, cortisol control is the
Yep.
important element to that journey for sure.
It's a big time. And then with our brothers, they don't get it. Like they don't get the cortisol situation. I'm like, y'all do understand the reason why you have a bigger bra size than I do is because of your cortisol, because of the amount of stress you're constantly taking in and not releasing.
Mm-hmm.
All your mother wounds that
Mm-hmm.
you didn't work through. Like that's why you have a midsection that has to be expanded every so often.
We as a community have a lot of healing to do, a lot of relearning to do. And once again,
Hmm.
a wonderful book out there in the world for us to start that journey. Herbal Harmony by Ms. Zaire Sabb. Once again, thank you for your time here today. And thank you to our listeners as well. We always appreciate you all tuning in. And for that, we would like to thank you with a 15% off for all the CEU courses on Midwifery Wisdom. You just simply use the code MWC POD 15. Thank you.
Thank you so much.